Okay, so the topic that we will be talking about today will be um, the issues that I'm seeing that people are facing, the three most common questions that people are having issues with. So I think that's going to be the most important aspect we're going to be touching on today. And if you have any questions, we can definitely go over that. One definitely is that I'm picking up on the one-to-one sessions is the question about your interesting case. A lot of people are very confused about that and how to handle that. How many of you have gone through the videos so far?
I have started, but I've not finished yet.
Okay, that's fine.
Yeah.
Anybody else?
I went through some as well, but I haven't finished them.
Okay, that's fine. Let me actually just go through so you have a broad idea about the program. Let me just share my screen. So I think that will be helpful for you to get going, to understand that a little better. Okay, okay, let's see this. Yeah, when you actually sign in, you log in, you see this, and okay. And then you go here to your student dashboard, all right? You probably see something like this. Okay, so I've disabled the audio to begin with. Normally what I do is whenever I'm watching anything, I speed it up to, at least 1.5. So at least 1.5, that makes it, I mean, up to you. But yeah, so there are multiple modules. I have around 10 videos recorded that are going to be uploaded, 10 more modules. So hopefully this next week, all of them will be uploaded. So the way you see it organized here is that you have your video. In some of the lectures, I have a framework video as well. And of course, you have the video, let's say the question, tell me about yourself. But the important thing is your template questions and answers. So I've given, for example, tell me about yourself. Depends on your experience. These are examples, but I have 3 templates for almost each question. Some questions that are generally not specific to a specialty or they're generally broad. I may not have all of these segments. However, for example, internal medicine, if you have volunteer work experience and community care experience, that is something for you to look at in detail. That is something that relates to you. If your connection with internal medicine is through research and critical care experience more, that is something you can pick on. You have some global health experience, diverse patient populations that you have experience with, wherever you've worked in remote areas perhaps, or you've had such experiences, then that is something you can look at. Always there has to be a relatable example. And if you have something, plug it in, but these are examples. You can copy this, change it for your own needs, okay? Internal medicine, family medicine, similar family medicine, more towards commitment to community care and continuity of care, preventative health care, holistic patient management. So for every specialty I'm looked to do about 5-6 specialties that have templates for you guys. And yeah, pediatrics will be more in line with, of course, kids. So these all templates are specific to your, what are we in? We are in internal medicine, most of us, pediatrics, family medicine. Anybody other than internal medicine here?
I applied to family medicine and internal medicine, both programs.
Good.
So I'm looking for both videos.
Good, great.
Yeah,
Okay.
I applied to family medicine only myself.
Okay, all right. So psych is here, general surgery. So yeah, so this is just a overview of this portal, how you will be going through this. Ethical questions, I have mentioned that they are ethical questions. So that is to get you an idea, good idea about how you will approach these questions. And some of the ethical questions are divided into different specialties because it will be different based on the specialty. Okay. All right. And let me just go back. Let me stop sharing and we'll go over. I wanted to share with you one question that everybody's having an issue with. And that is about why are you selecting our program? And why this program? Okay, that is a very, very important question. And let me see, somebody has a message. Okay, PEDS. Somebody's applied to PEDS. Okay, great. Yes, we have template answer for PEDS. All right. Okay, great. Let me stop sharing. All right, excellent. Okay, so I had, if you watched my video on this session, on the, tell me about the program. Why do you choose our program? Why do you apply to our program? Why do you like our program? What do you like about our program so much? So they can ask this question in multiple ways. Or what have you learned about our program, right? So what you need to do is, and you must know each and everything about your program. Let me share my screen again and show you. And I based my answer, my template answer on Geisinger. And I'm going to show you how you can do your research while going through the Geisinger website. It's very easy, and it's just takes a few minutes, and you know what is happening. So, for example, share this. This is the Geisinger website. It's very easy. You want to find any residency program, Geisinger residency program, right? And they probably send you links already, right? So this is a very important step, and they need to see that just you are interested, you studied their program, you actually know about some of the restaurants in that area. Here, you looked at this and you're a big foodie and you like Italian food, you like Chinese food perhaps. So much information right over here. You look at this residency program. Okay, what type of residencies do they have, right? They have different locations. Which location are you interviewing at? Internal medicine. Okay, so you know about the faculty. This is great. They probably have listed who are you interviewing with, right? Anybody who has interviewed, you already know who you're interviewing with, correct?
Yeah.
All right, so you can find almost everyone will have this. Everyone will have this. You can see the program director, right? Associate program director. Now, this is going to be very important. I don't know if you guys watched my video on what questions to ask. And that is everybody at the end of the interview asks you, what is the question? What do you have any questions for us? And you can look at their profile and you can say, hey, I looked at your profile. This was very interesting. And they're talking about this lady is in endocrinology. And I was also interested in endocrinology. If I want to go to fellowship in endocrinology, would there be a route for me moving forward? So this type of research you have to do about your person who is interviewing you. Okay, so the program director, associate program director. So there are many assistant programs. So you'll probably, if you have an interview from this place, you will have so many things. Program manager. So this is probably one of the most essential people. She doesn't have a profile here. But if they have some programs have the background of the program manager, the program coordinator, and maybe you talk to them, they will be there. Hey, I love your profile. Just build a small little connection with them. They will probably be part of the interview process when you are online. So, okay, faculty, residents, and you can find they have different things: research, resident fellow life, salary, benefits. So everything is listed here. So you know about the area, number one. How's the area? Is it rural? Is it urban? You can look it on Google Maps. Which big city is nearby? New York is about probably an hour, 2.5 hours from the area. Philadelphia is about 2 hours from this area. You have your paid time off, everything else, salaries. You have, let's see, research. Okay, let's go over here. Anybody who has interest in research, yeah, I love your program. Anything else you can, that you really need to know about this before you actually go in. And usually the program director normally has a vision for the program. Okay, so yeah, okay. This is a letter from the GME program director for diversity. That's something you may not want to touch yourself, this topic. Everybody has different views. But however, usually, in fact, the program director will have sort of a letter. Okay, so the other thing is meet your alumni. You can see where people are going. Now, this will tell you where their residents are going. Okay, hospital medicine, rheumatology, gastroenterology, endocrinology, primary care, pulmonary critical care, all at Geisinger. So now you also know. Now you don't want to be asking in that question, hey, what fellowships do you have? Because they will say, okay, you did not look at their website. Okay, so that is a no-no. And during the whole interview process, they will be giving you demonstrations. And make sure that you keep, make notes if you need to. Usually those things will be so easy for you to comprehend that you will know, okay, this question I can't ask because they already said about this during this session. So you will ask questions that has not been addressed. You could say, okay, yeah, I was very interested in knowing about your didactics and your research schedules, but I know you guys gave an excellent presentation. And I know there are research days, and I'll be looking forward to those research days. And you have asked so many of my questions, but I do have a question with you regarding with your own background, that you have. You are the chair of endocrinology, and endocrinology is a specialty that I'm looking forward to. Although I have not made my decision 100% right now. But is there sort of a mentorship program that we are looking forward to in this residency? So look at the website, make sure that you're following everything that they're talking about and all the reading material that I've provided you. Okay, so now if we look at, okay, let's go back here. Residencies, fellowships. Let's see, fellowships. Yeah, so you can see all the fellowships that are available. So cardiovascular, critical care, dermatology, gastroenterology, infectious disease. So you should know which fellowships are there. If you have an interest in a particular fellowship, then you definitely have an interest. You say this program is, of course, definitely well suited for myself because I am into pulmonary critical care. That is also my background, and I've had 5 months of experience dealing with this. And I definitely feel this is the future for me that I need to pursue. So serving the place where you're interviewing is very important. Okay. And you don't want to wing it. You don't want to be very general. Everyone says it has the right mix of autonomy and supervision. Everyone says that. But you need to give some exact, real examples that I like this about the program. You have these fellowships, you have this fellowship, you have that fellowship. I like the area. I Googled some restaurants in the area. I have some family connections. I've been in this area before. So you have to make sure that you really emphasize, yeah, I'll be great here, and I love the vibe. I love the atmosphere in this. I can see it. I can see it when I'm going through your presentations. So this is going to be a very important question. All right. Next question before we jump on to other aspects. And how many of you watched? I think that is the first. Let me just show the course again. Tell me about yourself. Let me go share screen, stop sharing, and share again. Okay. Tell me about yourself. How many have you prepared this answer? Have you had a chance? But this will open you up to every single thing from here on. This will set the stage. This will set the stage. So definitely start with this question, and it's going to be the first module. So make sure that you hit this first. Okay, let me just go over an answer here, so we can just go through this. All right. So not psychiatry. Let's do family medicine. Okay. So let's just go through it. Okay. Thank you for your question. I've always have been passionate about serving my community, and my journey into medicine was inspired by my experiences growing up in a medically diverse, underserved area. And from a young age, I saw how difficult it was for many people to access healthcare. And I knew that I wanted to work in a specialty that I could build long-term relationships with patients and improve the overall health of my communities. And during my clinical rotations, I was particularly drawn to family medicine because of the continuity of care that it provides. I love the idea of treating patients at every stage of their life, and being part of their healthcare journey is very important to me. One of the most rewarding experiences I had was working with a family who had recently immigrated to the US, and I helped care of their newborn, manage their mother's postpartum health, and also support the father through chronic disease management. This was an incredible experience to see how family medicine allows me to impact the entire family unit, and their well-being. I'm excited to pursue family medicine because I believe it's a specialty where I can truly make a difference, both in individual patients' lives and within the community. A relatable example that we have over here. I will never forget how grateful the family was when we managed to find a solution for their father's diabetes while also supporting the mother's postpartum recovery. It showed me the power of comprehensive family care, and it definitely solidified my passion for this specialty. So definitely you will look to mold this for your own self, and make sure it's very relatable to you, and plug in an example for yourself. So the tell me about yourself is going to be a very strong question that you definitely need to know. Okay, let's see if you want to go over one more. Anybody wants to give it a try, because I think it's all about practice. Anybody wants to raise their hand? Come on. Somebody said pathology. Khwaja Muhyiddin, pathology. If that's what you're interested in, I can work on that. I can definitely work on pathology if that's what you're interested in. Okay. No, we don't have pathology yet. Anybody wants to give a try? Let me select somebody. Rida, you want to give a try? Okay, Faisal Rashid raised his hand. Let's go with. Okay, Rida will try after Faisal. All right. Let me unshare my screen. All right. So. Okay. Excellent. All right, Faisal. Glad you are here today. How are you doing? How are you doing today?
I'm doing fine, Dr. Khan. How are you?
I'm well. Faisal, I love to, I went over your CV and there's so many interesting things. But can you highlight a few of your important aspects? And I think we'll kick off the interview like that.
Sure, Dr. Khan. Thank you for having me today in your interview session. I come from district Laya of southern Pakistan. I was born and raised in that district. My district is famous for its sweet watermelons and its raw lentils, which I can make in a variety of ways. I got my education from Allama Iqbal Medical College, which is one of the top 5 medical schools in Pakistan, and it is attached to a tertiary hospital called Jinnah Hospital, where I got to learn how to organize myself, how to work in a multicultural and diverse setting, and how to see patients and manage patients in busy emergencies and wards. Outside of medicine, I have been part of multiple projects, a couple of community projects, and some volunteer work as well during my med school and outside of med school as well. In my med school, I've been a part of a project called Humans of AIMC, which is a social media page. I was an interviewer and a story writer there. And other than Humans of AIMC, I was also the dining area manager for the boys dormitory of my school. Excuse me. And I have also worked as a volunteer in an animals refugee society. I am I am a community-driven individual, Dr. Khan. I like to contribute to my colleagues and to the people where I am living, and I am also driven towards clinical research. A specific project that I want to mention here is a cardiology meta-analysis that we started working in 2022, and we published it a year later in the Journal of Electrocardiology. Currently, I am working as a clinical researcher at the University of Louisville's Department of Medicine for the past 1 year. I work there as a study coordinator in 3 different studies, particularly pneumonia studies. And I have also completed 4 clinical rotations at the University of Louisville Hospital. I am very eager to share my experiences with you, Dr. Khan, and to learn more about your program. Thank you for having me.
All right, great. Tell me more about this Humans of AIMC. What is this?
Thank you, Dr. Khan. Humans of AIMC is a social media page. It's a Facebook community for our school. We usually go to students and to the faculty members in our school working over there, and the people who work at the shops and at the canteens. We talk to them, we take their interviews and let their stories published on our page. It was very much liked by our students and the faculty members. We got to publish 15 stories when I was working there with my team. So it was a great experience, I would say.
Okay, that's good to know. Did you have a huge following?
Yeah, we have around 14,000 people who follow us on the Facebook page.
Great, great, excellent. Okay, great. So Faisal, very good. Yeah, I think you hit the nail on this. You definitely mentioned your non-medical aspects as well as your medical aspects. You definitely need to have a mix of this. Okay, great.
Thank you, Dr.
Okay.
Khan.
So the next person I think who raised their hand was Abdul Rafe. You want to give it a try?
Sure.
So
Good
Abdul
afternoon.
Rafe, how are you doing today?
I'm doing good, Dr. Umar. Thank you for asking. Thank you for having me.
Definitely, it's my pleasure. And where are you right now?
I'm currently doing my prelim year at Westchester Medical Center.
Okay, great, great. Okay, great, excellent. And where are you applying to?
I'm applying to anesthesia.
Okay, excellent, excellent. And how's it right now, your prelim year?
It's going really good. I just finished with my neonatal ICU block, which was a completely uplifting and overwhelming transition, just looking at critical care aspect in pediatrics. And I'm looking forward to my hematology oncology rotation starting tomorrow.
Great, great. Okay. So yeah, so can you tell me a little bit about yourself? I know you've already in the residency sphere of things, but just for a background, if you may, thank you.
Of course, I would love to. So I'm basically an international medical graduate from Pakistan. I was born in Lahore, but despite having born in Lahore, I lived in all of the cities in Pakistan due to my father having a military background. And that really instilled in me the principles of adaptability and forging new friendships wherever I went. And during my medical school, that was a very defining feature of my life, which included a wide array of extracurriculars, including drama club, sports, debates, which really forged my speaking skills and my confidence. And at the end of which, I came to the US last year. I did rotations in 6 to 7 cities in the US, particularly Cleveland and Memphis. And I went back to Pakistan to do a 6 month mandatory internship in anesthesia and critical care. And I secured a preliminary pediatrics position, and that's where
Okay, okay, great. Are you looking? If I heard you correctly, you're looking for pediatric anesthesia?
That is my long-term ambition, but for now, I'm particularly focused on general anesthesia aspect, and I think my ambition of pediatric anesthesia is strongly strengthened by having done a preliminary pediatrics year to begin with, and then completing a general anesthesia training. I think this year will provide me with the basic foundation principles that should be expected of any pediatric anesthesiologist.
Okay, great, excellent. All right, good, good. So yeah, definitely. I you have a strong background. You already in this sense. And I think you should be ready. I would just plug in a bit more about yourself personally. Definitely, your clinical side is very solid. Just plug in a bit more relatable aspects. I think that'll be fine. You're pretty good, pretty good. Okay.
Thank you.
Thank you. You're welcome. All right. So I think we had Stefan.
Yes, Stephen.
All right, Stefan. So, um, tell me about yourself. I think you're interested in family medicine. Um, tell me a little bit about yourself. How do you connect with family medicine?
All right, thank you so much for having me. My name is Stephen. I grew up in Nigeria in Africa, though I spent a bit of my time in Australia before migrating to Canada, where I reside currently. I had my first degree in accounting. That was like something I did not plan for, but it happened. After spending some years in Canada, I had to go back to my childhood dream of going to medical school. It was a tough decision because then I've gotten a family, but I've always had a dream of being a physician. But events of life in Africa couldn't allow me to go to med school when I was very young. So I had to go back to school again to take up a bachelor's degree in biomedical sciences before migrating or before moving to doing medicine. So in medical school, I worked so hard, and I was on my dean's list for both basic and clinical science because of my high grade in medical school. And then during my clinical rotations, I also was in the dean's honor list. I had several patient encounters that's made me to believe that family medicine is the best option for me because I saw that family medicine has a holistic approach to patient care, which was my primary reason for going into medical school. And for me, to keep myself up to date with evidence-based medicine and having the best competency in managing my patients, I got involved into research. So I've published like 3 papers looking more into COVID-19 impacts and the vaccinations of COVID-19, as well as deaths related to obesity and diabetes. After medical school, I love to spend time with my family. I do fishing here in Canada during summer and winter. And I think, yeah, we'll dive more into more of my personality as we go into this interview. But for now, this is what I have to tell you. Thank you so much.
No, great, excellent. So, I really like it when there are candidates who have had different experiences and their background is fairly varied. Now, because what I've seen over the years is that they bring something fresh and new to the program. And in the past, people who have had different experiences, they actually add value to the program. And moreover, we've had people with business experience in the past, but you have an accounting experience as well as a biomedical experience. So I would love to, in the future, maybe we can connect and talk about your biomedical experience. We do have a biomedical engineering department with the university we're connected with. Would that be something you would be interested in the future to collaborate with?
Of course, I'm very much open to that. I'm more into research, and my goal is to be a holistic physician that will care for patients. So anything that will make me to be that holistic physician, I am very much open to that. That would be a welcome idea for me.
Great, excellent. The other thing I noticed was in your background. Let me just open your background back here. Is that family just for your family's connection, or the sign that you have at your back?
Yeah, no, this is just like my house design. I'm
Okay.
right now in my home, so it doesn't have anything to do with family medicine interviewing,
Right.
but it's just natural background I have prior to now.
Got it. Okay. So I just want to share So for example, I normally, you guys see this? You guys see this or no?
Yes, we can say.
So anything that you have that you can, that sense that tells them anything additional about yourself. For example, I have a different YouTube channel and I had 100,000 subscribers on that YouTube channel, right? So
Okay.
if I like stick it over here, they will easily see this. Oh, what is that at your, in your background?
Yeah.
Right? If you have a certificate that you got for someplace, stick it in your background.
Okay.
If you are a painter, you have a specific painting you drew yourself, stick it in the background. So it will just add a little bit of a dimension to yourself. Okay, great. Okay, now Rida, you want to go ahead?
Sure, I'd love to. First of all, thank you for the opportunity to let me interview with you today. I'm very excited to be here. My name is Rida Fatima, and I was born and raised in Pakistan. That's where I got all of my education from, including my medical education. During med school, I not only learned about the nitty-gritty of medicine, but also participated in every extracurricular activity it had to offer. I specifically remember being the president of Iqbalian Volleyball Club, and just organizing tournaments, and that really instilled in me the spirit of teamwork, sportsmanship, and I understood how to delegate tasks and make an efficient workflow. In addition, I also participated in arts society, and I'm basically a painter, and I also sketch. So, I stayed connected to my creative side throughout my medical journey. Then I graduated last year and did a 1-year internship at Jinnah Hospital in Pakistan. That's where I solidified my decision of pursuing internal medicine based on my experiences in different rotations throughout that year. Then I came to the US and gained about, I think, 5 months of clinical experience over here to basically compare the two healthcare systems. And then, based on the more streamlined training programs in the US, more robust didactics, I decided to pursue further training here. I currently live in Valhalla, and I'm working as a research assistant at Westchester Medical Center.
Okay, great. Yeah, I think, do you have any picture of your the sketches that you made?
I do, and currently I don't have them in my background because my husband is using that space, and that's Rafi. So he's using that space. So that's why I don't have them, but I will have them in the actual interview.
Okay, great, great, great. Okay, yeah, just have, yeah, that's fine. Depending on where you interview, they may have screen sharing options. So maybe you can show, oh yeah, these are my drawings.
Okay.
But yeah, always have something just to show. That'll be interesting.
Okay.
Okay, great. Yeah, before, I think we'll take one or two more before we jump on to the next topic. Okay, Pakiza, I think you had your hand raised. I think she just went off. Usman. All right, Mr. Usman. Dr. Malik. If you're muted, you just have to unmute yourself. Okay, so let's go to Noor. I think Noor has her hands raised.
Hi,
Hi, Noor. How are you doing today?
thank you. I'm good. How are you?
I am well. I am well. Where are you right now?
I'm in Lahore, Pakistan right now.
Oh, great. What's the time over there?
I think it's 7:30 p.m.
You
Yeah.
think or you know?
Yeah, I know.
Okay. All right. Great, great, great. How's the weather?
It's all right. It's better than before. Like it's less hot, so it's good.
It must be getting colder. It's still not cold in Lahore. It's what is this? Almost September.
It's
End of.
not cold. It's not cold, but the weather is milder now.
Okay,
But
great, great.
definitely not cold yet. Yeah.
Okay, good, good, good. All right. Have you been to the US before?
Yeah, I have been to the US. I was actually there in August and September of this year for my US clinical observerships.
Okay, great, great. Yeah, that's good to know. Which what type of observership was that?
So I observed at the University Health Truman Medical Center, which is in Kansas City, and I had rotations at the internal medicine department, and I also rotated at the cardiology clinic and at the hem-onc clinic as well.
Okay, great, great, great. Okay, great. Yeah, so we're just going over our candidates today, and love to talk to you as well. Can you tell me a little bit more about yourself, maybe a little bit of your background, and if you had any research experience, please do touch on that as well.
Sure. So I grew up in Lahore, Pakistan, and I come from a humble background, but I grew up in a very loving and supportive family. And growing up, I was always very close to my aunt who lived with us. She suffered from certain medical conditions, and I grew up taking care of her. And I think that is what made me very sensitive to the pain of the people around me. And I think that was what developed for me, what developed an interest in medicine for me. And I decided to pursue medicine. I graduated from Allama Iqbal Medical College in 2020, which is like one of the top med schools in Pakistan. And I graduated with honors. And after that, I did my house job from Jinnah Hospital, Lahore, which is a tertiary care hospital in Lahore. And then I started my residency in internal medicine in Pakistan. So right now, I'm in the third year of my residency. And during my residency, I have had the opportunity to work in different leadership roles. I have worked as the registrar of the medicine unit, and I have also had the opportunity to work as the resident in charge of the medical students. And other than that, I love to interact with my co-residents. I like to go out with them for like dinners and lunches and on one-day trips as well. So I love that part of my residency, interacting with the co-workers. And other than that, I have been involved in some research work. I did a cross-sectional study with some of my friends back in med school. We conducted the study in the OPD of the pediatric OPD of Jinnah Hospital, and it was on the incidence of diarrheal diseases and respiratory tract infections in infants up to 6 months of age with regards to the feeding modes that they had. Um, Other than this, I have been involved in some volunteer work. And in my free time, I enjoy photography. I am an amateur photographer, of course. During med school, I participated in some photography contests as well. And yeah, other than this, I enjoy cycling. I go cycling about 3 to 4 times a week just to keep healthy. Yeah, that was a little bit about myself.
Okay, very good. All right, great. So I have an interest in photography as well. Do you use a DSLR camera or a mirrorless camera?
I use a DSLR camera.
Okay, if you don't mind
It
me
is
asking,
a sorry.
if you don't mind me asking, which cameras do you use? Are you a Nikon shooter or a Sony or a Canon?
I use a Nikon D4900.
Okay, great. Yeah, I think my first camera was a Nikon D3200. Great. Yeah, maybe you can share some of your pictures sometime. But great. Okay, a couple of things I found good in your answer. So a lot of times when I'm interviewing, people will say that, okay, I'm from a poor background or a remote area, and they sort of say that I had a bad background, I had a poor upbringing, and all that stuff. So that sort of, to me at least, and what I've discussed with other people, puts a bad taste. But you were like, I have a very good, loving family. You are coming in with a base of strength. Some people may end up saying that, okay, um, they don't help females in our culture, and some people may say that, and I've had people say that, but that doesn't go well. You don't know what is the political understandings of that person that you're interviewing with, so you don't want to get political or gender issues. You don't want to bring that up as much. And you are perfectly solid with your answer that I had a very loving family, supporting family, and that's great. So always be confident. And then other aspect you mentioned was you're in your third year of your residency. So you could say, yes, I'm in third year of my residency and I'm proficient in all of these procedures. You're probably into central lines, A lines, maybe intubations. You're pretty good with all of these things. Then you mentioned about your research. One thing I would want to adjust with your research answer is you mentioned about your research. You should have a line, and we found this as the end result. We found this, and we're looking to study this a little further. This led us to explore this question a little further. So you talked about your study topic, but you need to talk about what you found out. What was the end result? Okay. And yeah, good. Excellent. All right.
Thank you.
Excellent. Great. Okay. So next is the question regarding your interesting case. So Abdul Rafi, since you interviewed last year, did they ask you about an interesting case?
Not particularly, not that I can recall in terms of having interest. Mostly it's a dilemma or conflict, but I can't recall that question you asked.
Okay. Where did you interview at last time around? What specialties?
I interviewed a few places in anesthesia and few places in medicine.
Okay, so maybe it's more of a question generally because many of us already have experiences, just like Noor mentioned that she has had experience, 3 years of experience. And they do know that people do fudge their CVs and make things up. And the prime reason they ask this question is, and there are different ways they ask this question. They may pose a question. They may give you a scenario and they will ask, okay, now what are you going to do? Right? Or they will say, give me an interesting case. And the only reason they're asking this is to make sure that you know how to present a case. And if you know how to present a case, that means that your clinical experience is valid. So you have to start off with, there's a 49-year-old patient, female patient from a rural area. Their past medical history of this, coming with a chief complaint of this, lasting for these years. This chief complaint lasting for these many months, with the pertinent review systems of this, pertinent vitals and physical exam findings included this, lab work demonstrated this, imaging showed this, and we were suspecting this. My role in this case was to take a history of the patient, and I was presenting it to my senior resident. And we were initially considering this aspect of care. However, later on we found out that this was that we missed this part of the history. And circling back with the patient, we ordered an ultrasound for the lower extremity, whatever. And we had a differential of this, but it was fairly obvious that this was the reason for the presentation. We initiated treatment, and the patient improved in about 2 days' time. And this was why it was interesting, because of this aspect. So you need to be able to present a case. That is the main reason they're asking. That is the main reason that they're asking this question. And anyone who has been in clinical medicine, you know that that's what happens every single day in the morning. You are presenting a case, right? Right? How many people are out of med school? And mostly, I think all of you are probably out of med school, and you have experience in presenting cases. Is that correct?
Yeah.
Okay, so have you anybody prepared an interesting case?
Yeah, for me, I haven't prepared any interesting case. I was wondering if we'll have the whole time leisure to present a full scale of case just the way you mentioned it now, starting from the name, the age, past medical history, past surgical history, labs, vitals, and imagings, if we have that kind of time during interview.
Yeah, so it's only the pertinent findings. It's only the pertinent findings. And it's the same situation when you're it's only the pertinent findings, the pertinent review system, the pertinent physical exam findings. So that should be very, very quick. And especially with clinical experience, they expect people to be able to present a case. Let me see. Excuse me.
Dr. Khan, would you suggest just explaining why the case was interesting while answering this question, or do you want, sorry about that, do you suggest going on about the whole history of the patient in order to showcase our presentation skills?
I think you will have to describe, you will have to give context. And that only happens if you have presented a case. It only happens. And it has to read like a story. You don't want to give the answer up front. It has to be a story, right? So you have to build up to it. So you're building it up, you're providing clues. You're providing clues. So when you are talking about the past medical, the person is coming in with shortness of breath, right? And you start to talk about past medical history. Or with the patient is coming in with shortness of breath, with the past medical history of Alzheimer's disease, lupus, and lupus and arthritis. Okay, so they will say, okay, shortness of breath, Alzheimer's disease. Okay, the patient can aspirate. Lupus can have multiple pulmonary symptoms, or lupus can cause loads of issues. So you are going through describing pertinent findings and going through in a stepwise manner that will build the case that you're talking about. And yeah, so it has to. I firmly believe you don't want to go into every single detail, all the lab that is not important. Only the pertinent labs, only the pertinent imaging findings. You don't want to read the whole MRI report. Okay. What you found in the MRI, right?
Yeah.
Excuse me. Omer has the hand up. Yes, Omer. Hello. Omer, are you there? You just have to unmute yourself. Hello, Omer. You just have to unmute yourself. I think you're good now. Yes. I think you're having some issue with your audio. Hello. All right, that's okay. When you can fix your audio, then we can talk to you. All right, so yeah, let me go over. I'm going to share. I wanted to share. Okay, let me just present a case of an interesting case to you. Okay, so hopefully it just goes smoothly. Yeah, I do remember a case when I was in my final year of my medical school, and I was responsible as part of my team to take the initial interview, and I would present to my team. And this was a 47-year-old male, and he was coming in with abdominal pain, right upper quadrant abdominal pain. No significant medical history other than GERD. And he came in complaining of abdominal pain, mild jaundice. Pertinent findings included included right upper quadrant abdominal pain with no significant radiation. Review systems. He had mild nauseousness without any without any vomiting. Pertinent lab findings noted transaminitis with a predominance of ALT. Alk phos was mildly elevated. Bilirubin was around 5. Vitals were stable. No fever. We were initially concerned, given that the hepatitis was pretty common, especially hepatitis A in our area, that this could be a presentation of hepatitis. However, we are still not sure about that because the patient did not have any fever. yet we explored further. But the next day around, I asked him more about his history, and he mentioned that the family ate out recently. And I do admit my mistake that I did not really take a history about his dietary habits. With hepatitis, that should be something I should have done on my earlier assessment of the patient. And he mentioned that they ate at a restaurant and he had uncooked seafood. From that, after that answer was revealed, we obtained a parasitic panel and we found liver fluke to be positive, and we started him on antiparasitic medication, and he recovered within a week's time, and the liver enzymes went back to normal, and he went home in about 4 or 5 days. So this was an interesting case, and as well as a learning experience for myself, that don't overlook everything, and sometimes you also have to go back and ask further questions if you're not getting a handle of a case. So okay, this is, as I just said, off the top of my off the top. So, but you have to just be very quick. This was very quick. I think within a minute. You don't want your answers to be more than 90 seconds. So a minute is a good enough time for you to talk about a case or anything. So it has to be it has to go through a sequence. Why it was interesting, any learning aspect in the middle, I think that should be very important. All right. Agreed, Abdul Rafi, since you've already had this experience. So,
Absolutely, yes, sir. Absolutely.
okay. All right. So any questions for today? All right. Tasham has his hands up. I think it's Tasham, right? And somebody iPhone has their hands up. I'm not sure if that's correct. Okay, let me see. You need to unmute yourself, I think. I think you need to unmute yourself. No. Okay, anyways. All right, so I think we will have weekly sessions. We look to have weekly sessions, all right? And I want all of you guys to go over the course. Let me just share the screen again.
So, Dr. Khan, my hands were up. I don't know why it was showing on Dr.
Yeah, I was confused. My bad. Yes,
Yeah.
Stefan.
Yeah, so I wanted to ask you, in terms of the timing for Tell Me About Yourself, what do you think is the most appropriate time to spend on that conversation?
Yeah, that's it. 1 minute to 90-second max.
Okay.
Yeah, that's why it's important to prepare for your answer. And if you look at my template answers, let me just actually share my screen. Where is this? Where is this? Hopefully I have the right screen. Yeah. So these are not long. These are not long. Let me do family medicine. Yeah, these are not long. But definitely the more personal thing you plug in, that will help out. Then they're not long answers, and that's enough. That's enough. You don't really want to bore them. A lot of people may end up repeating the same thing over and over again. You don't really want to bore them. The specific important aspects about yourself that you can really consider your strengths and your experiences, I think that's it. And some people were mentioning photography, vacationing. Make sure you have aspects that show about yourself as well as your medical strengths. Doesn't have to be too long.
Thank you.
All right. Sounds good. Everyone. Brita has her hands up.
Yeah, I do have a question, Dr. Khan. So when we're answering the question about strengths, do you think we should have a story for every strength that we mention, or is it okay to just elaborate the strength without, giving a story for every point?
So with every point, you should have some.
Okay.
So in my sample answer, I do remember I had given your 3 strengths. I had a small example with each one of them. And let's say for internal medicine, Yeah, I do remember I have example. Yeah, example, my ER rotation, I care for the patient who was emotionally distressed.
Mhm.
So everyone has a 1 or 2 line example.
Okay.
Okay. Ideally, I don't want you to go so long. Okay.
Mhm. Yeah.
But I mean, yeah, this is actually pretty good. I got so you have first, second, third, and you're summarizing your strengths. You don't necessarily need to summarize, but you could if you want. But
Okay.
every single thing has a small little example in there. Small little example. So this is adaptability, critical thinking, and teamwork, leadership, compassion, and time management, communication, organization, and empathy. And people say these are repetitive, but if you have an example, then it's not repetitive. It's personal to you. Okay. You
Yeah.
can't create something that's not there, right? And we all human, we have the same experiences, so we are going to be having similar strengths and weaknesses. You
Yeah.
don't want to give it a weakness. Oh, I can't walk.
Yeah.
So, or okay, I have ADD and I can't focus and I never will be able to focus in my life. So,
Yeah.
okay, then you're out. That's it. Okay,
For
interview
sure.
cut short. So
Yeah.
yeah, I mean, that's for weaknesses, right? So let me just show you the weaknesses template. Let's go to family medicine. So emotional involvement, delegation, public speaking, handling, over committing, asking for help. These are common, but if you can personalize them, then it's fine. Okay, these are common. If you can personalize them, that it's fine. Yeah. So I would say next time I want people to be, at least go through the videos at least. All right. I think for a couple of sessions and 1 or 2 sessions with your interview, I think you guys should be good. But still, you need to prepare. Last couple of years during COVID, when we switched from in-person interviews to, let me share the little bit of example that I've had with people. That people, from when we went from physical interviews to in-person interviews, sorry, to virtual interviews, people were not ready. They were flunking their first few interviews, their first 3-4 interviews. They had no clue what was happening, and they lost out, because they were not prepared. Because when we used to go in person, we would have to prepare. We would have to spend money, air ticket, train, or Greyhound, and book hotel rooms and travel, every single thing. So we would be prepared from day one. So, but when you are just saying, come to chat on the computer, yeah, you don't prepare for things, and then you lose out. So good that you guys are taking this seriously, and many of you that actually did attend. So yeah, you're really serious about this. So yeah, you're on the right track. So yeah, let me know any questions I can address during the week, and we'll try to see when we can do it next week, probably next weekend.